Arizona legislators were in direct, prolonged contact with President Trump's lawyer, Rudy Giuliani, last week. We'll tell you what's being done now that Giuliani's tested positive for coronavirus. Plus, Valley businesses have been hit hard by the pandemic. We'll show you how people have been stepping up to help them out. And COVID vaccine concerns, why the general public still has reservations about the rush to find a cure. We break it down later in this half hour.
Cronkite News starts now.
Good evening and welcome to Cronkite News Refresh on Arizona PBS. I'm Serena Raboyne. Thank you for joining us. The Arizona House and Senate will be closed this week due to coronavirus concerns. Last Monday, President Trump's lawyer Rudy Giuliani spent nearly 10 hours with the state's Republican legislators in a hotel ballroom in Phoenix. President Trump tweeted yesterday that Giuliani had tested positive for COVID-19. The 76-year-old Giuliani has been admitted to Georgetown University Hospital. Nearly all intensive care unit beds on the Navajo Nation are currently in use as COVID-19 cases continue to surge. Officials say healthcare workers there will soon have to make difficult decisions about providing care with few resources. Options are also limited for transferring patients to other hospitals, as those facilities are near capacity. The tribe has extended its stay-at-home order to stop the spread of the virus. Today marks the 79th anniversary of the attack on Pearl Harbor. The Air Base Arizona Flying Museum in Mesa launched a commemorative flyover today. The aircraft left Falcon Field in Mesa around 10:45 this morning and headed to the state capitol in Phoenix. Government buildings also flew flags at half-staff from sunrise to sunset. The U.S. Department of Transportation has granted an additional $638 million to complete a light rail extension here in Phoenix. The extension is expected to cost a total of roughly $1 billion. The 5.5-mile addition will connect with existing tracks that run from downtown to South Phoenix. The project is expected to be completed in 2024. The COVID-19 pandemic has impacted some of the Valley's small businesses. Now that it's the holiday season, many of them are hoping to catch shoppers' attention. I found out how one local shop is gearing up for the holiday season. It's no secret that small businesses have been struggling to keep their heads above water over the past few months, especially for a small boutique store on the corner of Camelback and Central, like Francis.
We definitely had a couple months where I think she was, wondering if, sales were going to, allow us to pay our bills. And it was definitely a really scary, unsure time.
Now that the holidays are here, it's extremely important for these small businesses to get people in the door.
When you're supporting a small business, you're literally helping someone and their employees survive. So it's crucial to support local and small any way that you can. Restaurants, food, businesses, boutiques, just in any way, especially around the holidays. If you're willing to, spend the extra time to source your products from a local business, then again, you're supporting someone's dreams.
One way that small businesses have generated more attention or clientele have been through curated lists on social media.
It's essentially the best marketing technique as well, because it is the brain process that people do where they're like, oh, my friend is, shopping at this cute boutique and I could definitely find something there. Or like, ooh, I've been really wanting to try that new food place or whatever. And I saw that so-and-so went there the other day. And it's just so important. And I love that social media has allowed people to do that.
These lists aren't the only thing that have come around to bring awareness to small businesses in the pandemic. Local First Arizona, a nonprofit dedicated to helping small and local businesses around the state, created a marketplace on their website to help generate sales for those businesses during the holidays. According to a press release, the Shop Arizona Marketplace is meant to help small businesses of all industries compete in a digital world and reach new customers. There are more than 50 local vendors offering a variety of products and gifts. Francis is one of those vendors on the marketplace, but they also support local brands as well.
What we try to do is source from local brands, and if they're not local to Arizona, we try and keep them small business owned. So like a lot of our jewelry, some of our clothing. So we really try and keep that small business theme and just really make sure that we're supporting local vendors when we can.
And these local spaces are worried that hard times are going to last much longer.
Absolutely think over the next year, it's still going to be crucial for people to support small businesses because we're going to continue seeing them, struggle, and that struggle will lead to them closing down for sure.
Maddox says that competing against big box stores is creating an additional challenge this holiday season. Francis is combating that by having an outdoor market on the 12th and 19th of December, where shoppers can buy directly from local vendors. The International Space Station will be visible this week here in Arizona. The best chance to see it tonight around 7 and tomorrow around 6 p.m. To find the exact times and directions for your part of the state, go to spotthestation.nasa.gov. Coming up on Cronkite News, we talk to a COVID-19 survivor about his battle with the illness. And we'll discuss why minority communities are disproportionately affected by the virus.
The COVID-19 pandemic has affected everyone in the United States, but minorities are being hit even harder, according to a recent study. Cronkite News reporter Delaney White spoke with a COVID-19 survivor about the reason behind these alarming number of COVID cases in these communities.
I talked to COVID-19 survivor Christian Lopez about his battle with COVID and the reasons minority communities are so disproportionately impacted by the virus. Many immigrant communities and communities of color lack credible information pertaining to COVID-19 prevention, often leading to higher case counts and mortality, according to a study published by Clinical Infectious Diseases. Dr. Mark Wieland of the Mayo Clinic is working to change that through the distribution of multilingual messages to immigrant communities.
Death rates are 2.4 times higher for African Americans compared with whites, and 1.5 times higher for Hispanic or Latino and indigenous groups. And this crosses over intensely with socioeconomic status.
The same study concluded that those of a lower socioeconomic status are more at risk for exposure to COVID-19, often due to crowded living conditions and essential worker positions. Christian Lopez, a restaurant worker, says he needed to return to work after feeling financial strain.
It happened to me a little bit later in COVID season, and mainly because I was tired of being stuck at home. And not that I purposely went out looking for it, but I just realized that I had to do daily tasks, and I was in the workforce because I can't, I couldn't afford to stay home any longer.
Shortly after returning to work, Lopez says he and his roommates contracted COVID-19.
So from a biomedical aspect, the higher infection rates and deaths in these minority low socioeconomic status populations are related in part to existing health inequities, namely higher rates of chronic diseases that lead to worse COVID outcomes like diabetes, obesity, hypertension, and so forth, as well as disproportionate barriers to healthcare access and utilization.
One of the biggest risk factors affecting minority communities is the lack of access to healthcare.
Healthcare is still a huge issue, especially with those communities, because of a lot of, they have such big families and they are in such low income areas. They're not able to access a lot of that still.
The Rochester Healthy Community Partnership highlights how medical experts can partner with community leaders to bring reliable health information to minorities. In early March, RHCP found that even though there was credible COVID information being produced in many languages, it was not reaching immigrant communities.
We adapted the CDC Crisis and Emergency Risk Communication Framework, which can be used to encourage public participation in disease prevention and containment. And the principles of the framework really resonate. So they are things like to be correct, to be credible, respectful, to promote action, and to engage with communities in order to empower decision-making.
The information is now being distributed by more than 26 communication leaders in 6 different language groups. Delaney White, Cronkite News.
Wearing a mask has become a habit for most of us. And now you may miss smiling at a stranger who holds a door for you, or at the worker who helped you find your size shoe at the store. The hard of hearing community is missing out on more than just grins. Cronkite News reporter Faith Abercrombie discovered why clear face masks are more effective for this community.
About 1.1 million Arizonans are deaf or hard of hearing, making up about 15% of the state. And while not all of those people can lip read, they do rely on seeing the whole face when they are trying to communicate.
And today we're seeing a decrease in COVID patients needing a hospital bed.
Important announcements are often relayed to the public with a sign language interpreter. But everyday communication with the deaf and hard of hearing community looks a little different.
You can put your lipstick on or whatever you want.
Sometimes when people talk quietly, it's kind of hard for us to hear. So we have to say, can you please speak up? And sometimes they don't want to, but they need to in order for us to hear.
The deaf and hard of hearing community relies heavily on visual interaction, facial expressions, and sometimes even lip reading, making clear mass more approachable.
Because you can read the lips.
But it's a common misconception that all deaf or hard of hearing people can lip read.
Yes.
I can't lip read, and people can't read my lips. I can't hear. So that's tough to communicate out in the world, out of our, deaf interactions. It's been tough.
With majority of the community wearing cloth face masks, this raises some concerns.
People want to go and vote in person. What is that going to look like with the mask? How am I going to feel comfortable? And if some information is being shared, or if one of the workers are standing there, how am I going to know?
Here we've been able to advocate and get the vice principal has purchased clear masks for all of the students and the teachers.
If clear face masks
right here's the nose
aren't accessible to you,
putting a barrier in our communication when we're out, we're requiring wearing a mask.
Klumhouse and her daughter share some advice.
Have patience. If you do come across somebody that does tell you that they're deaf or hard of hearing, don't brush us off, I would think is one of the biggest ones. That, for me personally, that's a huge peeve because that's almost like dismissing me. And, I'm a human like anyone else.
The community is able to request a face mask on the Arizona Commission for the Deaf and Hard of Hearing's website on acdhh.org. ACDHH hopes for more businesses that are customer-facing to wear the clear face masks. In the Broadcast Center, Faith Abercrombie, Cronkite News.
The World Health Organization says over 200,000 Americans die each year of preventable medical harm. One local Valley doctor is hoping to change that. His mission is one part Forrest Gump, one part Field of Dreams. Cronkite News reporter Rachel Phillips tracks his march today for World Patient Safety Day.
After watching the hit 1994 film Forrest Gump, Dr. Dave Mayer felt inspired, not to run across the country like the Tom Hanks character, but instead to walk all 30 Major League Baseball stadiums, to deliver one simple message.
Every day I walk in memory of a caregiver or a patient that's lost their lives due to preventable medical harm.
According to the patient safety movement, preventable medical harm ranks as the third leading cause of death in America.
I saw too many patients that lost their lives due to things that were preventable, and so I got very interested in quality and safety.
Dr. Mayer is spending his mornings training at Peoria Sports Complex in preparation for his next leg. He and 49 others, one from every state, will meet in Washington, D.C., where they will walk from the Freedom Plaza to the Capitol in honor of World Patient Safety Day.
Many of the people are walking, like I said, have lost loved ones, and they're going to be wearing shirts with their daughter or their husband on the shirt to commemorate.
Carol Hemelgarn is one of the 50 people walking. Her 9-year-old daughter Alyssa was diagnosed with leukemia and died only 10 days later because of multiple medical errors.
They did not see she was becoming septic. They thought she was anxious. And they kept treating her as someone who was anxious when yet you look at the medical record, you see she was all the classic signs and symptoms.
These people turn their losses around and say, we're going to try to leave a legacy for our loved one.
It's going to be emotional. I can feel it.
After World Patient Safety Day, Dr. Mayer will continue on his walk to America's major league stadiums. For Mayer, baseball represents survival, a metaphorical field of dreams.
I love all sports, but there's something about baseball. It has been that one constant in our lives, at least mine, to save one life. if 1,400 miles saves one life, it was well worth it.
Rachel Phillips, Cronkite News.
Dr. Mayer has already hit 17 of the MLB ballparks since February, and his next stop on the list is Philadelphia.
That's it for Cronkite News tonight. Thank you for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.